The March of Dimes recently revealed the results of a set of reports called Where You Live Matters. The results are sobering, to say the very least. U.S. maternal health continues to decline due to limited access to health care for far too many women. Dr. Elizabeth Sherrote is the Chief Executive Officer at March of Dimes, and she is here to talk about those reports. Good morning.
Hi, thanks for having me, Angie.
Well, thank you for being here to talk about the results of the study. So what prompted the March of Dimes to get this study launched?
Well, I really appreciate it. We've been doing this data since about 2018. This is our most recent data, which opened today, or we launched today, that 5.6 million women live in counties where there are no or limited access to deliver in these counties, as well as obstetrical providers. So it's affecting about 30% of counties across the United States, and access to care, it matters. So when you start looking at the data, you realize that geography, it depends where you live for some of these outcomes and where these women get access to care.
So can you name for us the cost when women do not have access to care?
That is, Angie, the cost is that when you look at women who have not had prenatal care comparatively to other women who have prenatal care, they are 3 to 4 times more likely to die. So it's a sobering statistic. And specifically when you look at Indiana, in Indiana, 23.9% of counties are defined as maternity care deserts. So those are women who are at risk. And if we can really get them the care they need, their outcomes will improve. We've also seen that 15.5% of birthing people received inadequate prenatal care in Indiana specifically. Our reports go state by state looking at this data.
And so when states see these results and they see where these deserts are, what actions are being taken or what actions are being prompted by the results?
Yeah, Angie, this is a way to really look at the data, is thinking about what can we do. And there isn't just one solution. If I had that, we would have done it already.
Yeah.
There are multiple layers to this. And one of the things the March of Dimes does is we have mobile units. We actually get out to these maternity care deserts. We bring the providers to the patients. We're also doing doula work where we get into the communities and we have support for birthing moms. We also have things like education at March of Dimes, but another thing we do is really advocate in every state to extend that postpartum period coverage for a full year. That's the Momnibus Act. Realize, right, you don't just recover after 6 weeks of having a baby. You still have a chronic condition like hypertension or diabetes that affects you. You need to get that care, not just 6 weeks after you deliver, but continual care for that next year. So core to the March of Dimes is really about education, advocacy, obviously this data, and our programming.
So where can the viewers go to perhaps read the report or to learn more?
Yeah, marchofdimes.org is our website, marchofdimes.org with a /MCDR, so Maternity Care Desert Report. If you go there, you can actually download the report for your state or other states, but you can also donate to the March of Dimes.
Dr. Sherrote, thank you so much for being with us and for sharing these results.
Thanks, Angie. Appreciate it. Thanks for the time.
Of course. More Lifestyles for you right after this. Stay with us.